Karen Ashforth, and my colleague Lesli Bell and I are here to do a presentation for you on pneumatic compression. A little bit about my background. I've been an occupational therapist for nearly 40 years, and almost half of that has been in lymphedema practice. I have to say it's been the very best part of my career. I work currently at a hospital-based outpatient lymphedema clinic in Stockton, California, and Leslie's going to tell you a little bit about her.
Hi, I've been a physical therapist for about 37 years. I own a private practice in Burlington, Vermont, and treat a combination of orthopedic and cancer-related diagnoses. And I too think that this has been the best part of my career. Lymphedema treatment is incredibly valuable.
The topic of this talk is evidence-based use of pneumatic compression. When we were going through our training many moons ago, we didn't really know too much about pneumatic compression, so we're very happy that we can offer this to you from the get-go. And thinking back, the big questions that I had were, why use pneumatic compression? And then a question that we're asking in this presentation is, why use Lympha Press as pneumatic compression? So when we think about the applications of pneumatic compression, we're looking at using it both in the clinic to assist with the reduction phase and accelerate it, but also as a means to do a trial so that we can see how patients will do at home. As part of the home program, pneumatic compression can be very valuable to patients for maintaining the reduction that we've gained and to continue to self-manage their lymphedema symptoms. When I assess a patient, I like to begin at the end. I want to look at what my discharge goals are going to be, because I would like all of my patients to ideally be independent in self-management of lymphedema. So how do we help our patients successfully manage their symptoms with a comprehensive home program? The addition of pneumatic compression can be very powerful and effective for many patients that might struggle otherwise with the standard home program that we would give them. So this patient is someone that I see very, very frequently. And is this someone that would benefit from pneumatic compression? Why would we even think of pneumatic compression for a patient? Not all of my patients are able to manage their lymphedema symptoms effectively. Some patients have very profound damage, either from radiation fibrosis or other types, surgery, different types of trauma, and as a result, they might have decreased range of motion, strength, dexterity, and even pain, which might make it very difficult for them to even put on compression garments. Some patients don't have good caregiver support. They're all by themselves. So there's many, many different factors that could point to a patient being more successful in their home program with the addition of pneumatic compression. What does pneumatic compression do? It provides both decongestion and compression. We'll talk a little later about how it prevents cellulitis and helps heal wounds. It's very, very easy for patients to use. And I have found personally in my practice, and it's also been shown in other evidence, that there's a high compliance rate for patients using pneumatic compression. Also, it's important to consider the big picture and how having a modality such as pneumatic compression can significantly reduce healthcare costs for patients. Lesli and I put together some frequently asked questions, because even though you may not ask these questions now, down the road, they might come up.
One of the questions that we hear frequently is that people are wondering if pumps cause genital edema. And I know, Karen, you have a lot of experience with this. What are your thoughts on this?
Oh, thank you, Lesli. Yeah, I do see a lot of patients with genital edema, and I think that using pneumatic compression is a godsend for these patients, because it really helps to provide that compression and decongestion in the genital area. It's more comfortable than wearing an ongoing genital compression garment, and it gives these patients an awful lot of relief. The fact is that you can use pneumatic compression very effectively in treating genital edema if you're using the right appliance.
Oh, so we are so grateful that we have the opportunity to use these pump sleeves that can cover the upper thigh and the lower torso.
Absolutely.
So a question that we often hear is, can pressure be harmful, or can we treat both legs together at the same time? Something to consider is that a pool provides up to 75 millimeters of compression on the legs. It can be even more at different times. Water, when we go down 3 feet, provides 1 atmosphere of pressure. So anything that we provide with the pump is not going to be any more compressive than a pool would be. So patients find this very comfortable, and that's actually how gradient compression started for garments, was by the effect that the pool has on the patients. So by having both legs in your pool, you are treating them both together. So it cannot be harmful to use compression on the legs with a pump at the same time.
Here is an example of the Lympha Press pants appliance. As you can see, the garment is designed to provide bilateral therapy, which includes comfortable compression to both legs simultaneously, as well as the abdominal area. The device can be used in a pre-therapy mode that starts proximally, before moving into a sequential or wave cycle for the remainder of the therapy. Wave simulates a gentle peristaltic movement, while sequential offers a distal hold as the massage moves up the garment one chamber at a time. Pressures are adjustable between 20 to 90 millimeters of mercury and can be titrated to the patient's unique need. One of the features I like about the Lympha Press pants appliance is the ability to provide focused therapy over the inguinal lymphatics and trunk to promote lymphatic drainage in the truncal and genital areas.
Another question that we often hear is, are pumps expensive? Something to consider is that they've been covered by Medicare for quite a long time, and they're also covered by many private insurers. Medicare doesn't cover compression garments, which is very interesting because that is part of the patient's home management program, but it does cover pneumatic compression. And this is a benefit to the patient because, once again, it's a very easy modality to use, it's very effective, and there is a high compliance rate with it.
So when we take a look at Medicare's reimbursement criteria, Medicare is considered to be the gold standard among insurances. So most private insurances will follow Medicare's lead. And Medicare has the requirement that the patient have a qualifying diagnosis of primary or secondary lymphedema. And there also needs to be a documented failure of conservative treatment to be able to manage symptoms. I personally have a problem with the word failure, but it doesn't mean that the patient has failed or the therapist has failed. It means the treatment has failed. And it means that for 28 days, if a patient is using elevation, exercise, and medical grade compression, and they still have uncontrolled swelling, then they could be considered as a candidate for receiving pneumatic compression via their insurance. So we're all manual therapists, and the backbone of our lymphedema treatment is manual lymphatic drainage. Lesli, how do you use pneumatic compression in your clinic, and do you find that it's as effective as manual lymphatic drainage?
I use it in concert with the manual lymphatic drainage. And if we think about the rules of lymphatic drainage and the opportunity to clear those proximal lymph nodes beforehand, we would want to do the same thing when we're using pneumatic compression. Sometimes my patients come in and they have so much fluid in their limb that I can't possibly take the amount of time to clear that out in one treatment. So when I get to use a pneumatic compression device or the Lympha Press in my clinic during that treatment time, it's like having 4 lymphedema therapists working on that patient at the same time. And it gives the patient a much better opportunity for change. And I can often move that treatment process along and get them to the final stage of complete decongestion a little bit quicker.
I see a lot of lymphedema patients at my clinic who have wounds. And I have found that using pneumatic compression helps to accelerate their wound healing. It decreases their swelling and their wound size circumference. And it really helps with patients that are prone to recurrent wounds. Those are the ones that are going to benefit from pneumatic compression at home because it's going to prevent the wounds from coming back over and over again. This is also one of my patients who has a very nasty case of cellulitis. And I was very interested in this research that showed how much more likely, 71 times more likely, the risk of cellulitis with lymphedema patients, and how pneumatic compression can really benefit these patients so that they are not having the ongoing damage and problems associated with cellulitis. So next, we want to show you a video of leg sleeves. And these are different from the pantsuit. These just treat the legs, but are very, very appropriate with our venous patients that have lower extremity lymphedema and wounds and are prone to cellulitis.
People often wonder, what are the contraindications for using pneumatic compression? And one thing you need to know is that it's very similar to whatever contraindication there would be for manual lymphatic drainage. If you wouldn't do MLD on the limb, then you might not want to use pneumatic compression on the limb. So we want to use a little caution with patients who have some peripheral neuropathy, with patients that can't feel what's going on in their lower limbs very well. Again, Karen just addressed wounds a little bit, so we want to pay attention to those wounds. You know, is that skin fragile? Do they have a great difference between the calf size and the ankle size? You might want to go ahead and build that up just a little bit. Do they have cardiac disease? Cardiac disease is a relative contraindication, and certainly if we're worried about that patient's ability to tolerate a fluid load, we might want to check with their physician first. Don't treat the abdominal area during pregnancy. That's pretty standard. And high pressure is not recommended for patients with peripheral vascular disease.
So the benefits of using pneumatic compression in the clinic, as I mentioned before, it accelerates the reduction phase. And I use it often at the beginning of my treatment so that I can reduce the patient rapidly and can have more effect with my manual therapy and different modalities that I might use for treating scar tissue. As Leslie mentioned, we use all the MLD pre-clearing techniques when we start pneumatic compression treatment. And it's a good idea to start using a lower pressure with a patient, especially if they're doing this for the first time. And then we titrate the pressure upward to figure out what their comfort level is. How can we get the highest amount of pressure that's still comfortable? We always want to have a barrier that is covering the skin. And in my clinic, if a patient has bare skin, I use a sheet or a pillowcase or a gown as a barrier. And we want to have patients that are wearing elastic garments remove them if they tend to bunch up, because that can create breakdown. In some cases, if the elastic garment is nice and smooth, then it's not generally a problem to use pneumatic compression over that. An interesting thing is that there is actually a billable untimed code that I use very frequently in my clinic for vasopneumatic treatment, and that's the CPT code 97016. And my boss loves me because my productivity is very, very high, because when I use pneumatic compression as an adjunct to my clinic treatment, I can bill this code, and it gives me an extra unit of service. So when we're evaluating patients and whether they are appropriate for pneumatic compression, again, we want to see, is their current lymphedema program effective? And can they carry out their own manual lymph drainage? Even despite everything we've given them, do they have continued uncontrolled swelling? So for patients who are in current treatment, or patients who have had treatment before who are returning because they're struggling, I think it's very important to consider that pneumatic compression is a powerful and effective home treatment that helps our patients control their lymphedema symptoms at home. I included a picture of the order form so that you could see how ridiculously simple it is. It's a checkbox form, and along with documentation and demographics, there's a prescription sent to the physician, and it's really a fairly easy process to get pneumatic compression for patients.
So when a patient's going to use this at home, I want to think about getting them ready for that from the day that I start treating them, as Karen said a little bit earlier. So anything that I ask them to do at home, I'm going to want to show them in the clinic first how they use it and figure out what pressure tolerance they're going to have. They need to understand that this does not take the place of compression garments nor MLD, but it's an adjunct to that treatment. It may give them a little more leeway at times. So if they are planning on going out somewhere, or they have a difficult day, or sometimes I tell my patients on their birthday, they don't have to wear their compression garments. And it allows them to come back to that place where they're they're stable and they're back to baseline, and it helps them to maintain that reduction.
So Leslie was mentioning pressure ranges, and I think that is a big learning curve for many therapists, because how do you determine how much pressure you use with patients? And I think it's pretty easy, because for patients that have very mild swelling, low body mass, if they have wounds or insensate areas or fragile tissues, you'll want to start with the lower pressures. But if you have someone who has very severe swelling, fibrosis, or high body mass, then they're going to require, as Leslie mentioned, much higher pressures to be able to get a decongestive effect. This is a poster that I developed in conjunction with Drs. Mouse and Shingale and presented at the International Lymphology Congress 5 years ago. And this gives some ranges for different diagnostic categories and could be helpful to you. This is in your, we have some materials, some handouts and videos in addition to this video that accompany what we're talking about. And this might be very helpful to you for getting an idea of what would be an appropriate pressure for a patient.
So Karen, both you and I think that following the evidence and understanding how research might move our practice forward is really important. Can you give us a little information about what might be going on now?
Absolutely, Leslie. I totally agree that having an evidence-based practice is very important, because we want everything that we do to be backed up by scientific research. And I'm so excited about the research that's been done in the field of lymphedema. And particularly, there's a recent research project that was published 4 years ago by Melissa Aldridge that studies the use of near-infrared iodine green imaging to show the movement of lymph with pneumatic compression. And she studied near-infrared visualization to look at lymphatic flow with pneumatic compression. What's exciting to me is that when she used pneumatic compression and looked at the actual lymph flow, she could see that there was significant lymphatic vessel recruitment and increased lymphatic uptake and propulsion in the lymphedema affected extremities, not only during the trial, but after pneumatic compression use. This next slide shows you the special clear sleeve that was used in the study on the left, and on the right, you're actually seeing lymph movement. And in this next slide, you can see very, very clearly how the lymph is moving as a result of the compression from pneumatic compression.
Such an interesting slide.
I love this slide.
I love this slide too. Lympha Press has compiled some research for us, and this information is included with the online learning materials that you will have access to. Know that there is a lot of evidence around pneumatic compression, and the research has been done for many years. The common thread through it all is that it's very beneficial for patients, and it adds to the ease of their self-care. Many physicians have been looking at the effects of pumps for years, and it's just being more refined as we look at things such as the Aldrich study and being able to actually visualize it with that indocyanine green process. So some of the advantages to the Lympha Press product are comfort. There's a short cycle time with a greater pause time, which provides a rest between the pressure cycles. And this is a little better for patients with wounds and neuropathies. There's a complete deflation, which facilitates lymphatic uptake, much like when we're doing manual lymphatic drainage. There's also a wide range of pressures available with this product, with pressures from 30 millimeters all the way up to 90 millimeters. And those 90 millimeter levels are something that we would use when we have a patient with a lot of fibrosis, very thick skin. And this helps to improve the decongestion phase, and it's safe to use without interrupting any kind of arterial or circulatory issue. Lympha Press also has a mobile app which allows custom programming for the device, and it's easy for that patient to use. If they can't reach the pump, they can actually make those changes to their pump or turn it on and off from their phone. So this adds to the ease of using it as a home program.
So in addition to looking at the advantage of the Lympha Press pumps, the appliances also are really a cut above. They are very easy to put on and easy to clean, unlike other manufacturers. And they inflate to fit a patient, which gives them a much more reliable treatment than having to pull Velcro closures. I really love the ability to be able to treat the proximal parts of the body, the torso, the abdomen, the genitals, and the axilla, instead of just having single arm or leg sleeves, unlike some pneumatic compression devices. There's also a nice feature which is not found in very many other garments, which is the overlapping chambers. And they have in the Lympha Press appliances a 30% overlap, which is important because this follows the principles of bandaging and allows for smooth compression without pressure gaps, and it prevents trapping swelling between the chambers, which also prevents reflux and dermal backflow.
As Karen just described, we're always looking for the opportunity to move that fluid up the leg more smoothly. And with the overlapping chambers, we avoid those gaps between the chambers that you can see here on the left picture. And then that actually translates into what you see on the right-hand side of the screen. And this slide shows you exactly what we're talking about. And you can see the diagonal movement of those chambers and how they do overlap. So that follows those principles of bandaging, as Karen described a little bit earlier. One of the wonderful things about Lympha Press is that the appliances are really easy for the patients to get on and off. And they've been very thoughtful about adding a few features that help the patient to be more independent. One of those that you can see on our comfy vest right here is the zipper that goes to the hand. And the patient can unzip that, and then they can more easily adjust the straps that are going around the torso right there. And that just increases their independence in using this product. So in this video, what you can see is a patient actually putting it on, and look how easy it is for her to use.
So Lympha Press has many different types of appliances that treat specific needs, from the upper body to the lower body, to the proximal treatment of abdomen and genitals, and even specific pumps and appliances that are designed for bariatric patients. I think that it's very important to acknowledge that there are many different types of pneumatic compression devices and manufacturers out there, and that they're not created equal. Many of them have very limited programming. Many of them have long cycle times, which can create discomfort with patients. Many have very limited pressure ranges and only have the capacity to treat an arm or a leg without the ability to treat the trunk or the abdomen. Some have appliances that are very difficult to put on. They may not fit the patients well and might be uncomfortable to use. And as we mentioned before, it's important to consider that the chap-style lower extremity garments that don't cover the upper thigh and the abdomen and the genitals can actually push fluid into those areas, creating extra swelling. The non-overlapping chambers in most of the appliances out there create a very uneven pressure. And many pumps have a limited deflation, which can create a tourniquet effect, pain, and poor edema uptake.
This particular pump has a wide programming capability, and it's very versatile and easy for the patient to use. Lympha Press has addressed the problems that Karen just discussed, and this has created a superior patient experience. Lympha Press has over 40 years of experience with pumps, and it's used in over 37 countries around the world.
So to sum it up, Lympha Press effectively treats lymphedema. And this treatment can prevent debility and the progression of lymphedema and improve our patients' lives. Having used so many other pumps, I have to say from personal experience, Lympha Press systems simply have the very best range of features and appliances to treat lymphedema. And this empowers our patients to their highest function. So this patient had gone through the reduction phase and was in a maintenance wrap style garment, but you can see on the left how she was still really struggling with lymphedema. And when she came to me, I assessed her for pneumatic compression. And you can see on the right that she deflated significantly. And she went from a situation where she could literally not lift her leg onto the bed and needed the assistance of both her husband and her granddaughter to get in and out of bed. And after being able to use Lympha Press on a daily basis, sometimes twice a day at home, you can see that her leg deflated beautifully. She's able to independently get in and out of bed, and she could walk better. So this is kind of an extreme example. And this patient, you can see, she's affected by swelling because of her mastectomy, but it's not real obvious unless you actually palpated her arm. And this is someone who was starting to get a harder and harder arm. And even though we used the MLD and bandaging and then eventually elastic compression, we could not get a handle on the hardness that she was experiencing as a result of uncontrolled swelling. So after she started using pneumatic compression, she was a lot happier because it allowed her to use her arms more easily. This is a quilter, and so she really needed to be able to have the dexterity and the range of motion which pneumatic compression helped her achieve. So to sum it up, pneumatic compression is a great modality to use in your clinic and to send home with your patients for those who need that powerful, effective treatment. Thank you again.